As you can see, the name Anemia, and the context is the querent's wife woke up one morning with complaints of possible blood pressure problems, extreme weakness. She was kind of fainting. He didn't know what to do, and she didn't know what to do, so they were kind of at a loss. So he asked the question, what's wrong with her and what can we do? Let's see how the chart can help them. The querent is the sun. House 7 is his wife. So she's signified by Saturn. And that's important, right? So Saturn will signify her body and her health in general. Now we're going to determine what's wrong with her. The technique that we're going to use applies to 90% of the cases of humoral diagnosis. And it's extremely simple. The planet that is the dispositor of the body or the person is the planet that describes the cause of the imbalance. Okay, so she's signified by Saturn. Well, Saturn is in Libra, so its dispositor is Venus. So Venus is the cause of her imbalance. And by analyzing Venus, we're going to determine the type, degree, and mode of the problem that she has. So she woke up this morning fainting. What's going on with her? And you will see the beauty of this technique because it describes sharply the condition from different angles. So let's go one by one. Let's look at the mode first. You will see that the Libra's mode is cardinal. The mode of the sign where Venus is also cardinal. And one thing that happens here is that many people who try to diagnose use the sign where the body is to diagnose. So they will see Saturn is in Libra, therefore Saturn has an excess of air. And that's a problem, that's a mistake, a basic mistake. The diagnosis is performed from the dispositor. So the fact that Venus is in a cardinal sign, that's what matters. If Venus was in a fixed sign, that's what we would read, not the mode of where the body is. Okay, so that's really important. That's the first thing that you have to keep in mind. So Venus is in a cardinal sign. What does that mean? It means that cardinal imbalances are imbalances that come to the surface and then disappear rather quickly. Cardinal imbalances are usually acute crises. It's something that happened today for a particular reason. If we find a solution for it, it's going to go away and will not bother her anymore. That's the general concept of a cardinal imbalance. A mutual imbalance behaves differently, and a fixed imbalance even differently. A fixed imbalance means something that is difficult to change. It came to the surface, probably over time, and it's going to be very difficult to restore. The second thing we look at in relation to Venus is the degree. Look at this document and see if you can find Venus and see if you can find the degree of imbalance. I'm going to show the chart briefly. Venus is at 27 degrees and 27 minutes of Capricorn. Okay, so here. And Venus is at 27 degrees and 27 minutes. So it's between 12 and 30. So between 12 and 30, it's cold in the extremity of the 4th degree. It's very cold. She's fainting, and the condition of her body is that she doesn't have energy. She doesn't have heat. It's like the fire has gone out. And that's really descriptive, isn't it? She's fainting and she's extremely weak. It means she doesn't have energy, no vitality, no heat. Heat equals energy. And as far as moisture is concerned, she's very dry. It's dry in the beginning of the 4th degree, so it's very severe too. Whatever happened to her drained her of her energy, and the dryness in this case means that things cannot flow. She's dry, basically, so things are stuck. So she has an excess of earth. Think about a rock or clay or a piece of earth. It's cold and dry. But if she faints, it's a perfect example of an extreme earth condition. You faint, you're alive, but your body cannot move, cannot do anything externally. So it's extreme earth. So here we determine the degree of imbalance, Capricorn shows us that it's pretty severe. So let's go back to the chart now. The mystery now is what could have caused this to her. This is one thing about astrology that's really, really important. This is not intuitive astrology or psychic astrology, where you kind of look at the planets and pick some kind of meaning for it. It's really, really important, and as in any type of horary, to understand the context. And in a situation like this, the only way to understand the context is to talk to the querent, talk to the patient or to the person who is being investigated, and figure out what's going on. Because when they describe what's happening to them, they are giving you information. And that's the only part that's intuitive, because their desire to convey to you what's going on with them is their way of passing information about them to you. So they're going to use certain keywords, certain phrases to describe their condition. And you as an astrologer are going to take those phrases and words, that story that they tell, and you're going to overlay that on the chart, and then see if the planets, the positions, everything in the chart, the houses, the signs, match that what they're describing. Because some things they describe are irrelevant, but some things are so relevant that they will appear very clearly on the chart. So far, we've seen that some things are very clear, right? The fainting situation and the excess of Earth is very, very sharp and accurate. So now let's try to find the reason why this happened. The key piece of information is that in the previous day, she had an extreme menstruation discharge. So she had her period, so she lost a lot of blood. Just by hearing that, you can match with the symptoms. Remember that one of the names for air, the element air, is blood. It means blood. And we remember that blood or air is the opposite of earth. So she has an excess of earth, and she lost a lot of blood. She has too much earth, and she has too little air. So she's too cold and too dry. The reason she's fainting is because of that. And what happened is that she lost a lot of heat and a lot of moisture. Okay, so it's always very logical. If you had too much of this, you have too little of this. And she just described exactly what happened. She lost a lot of blood. We can look at the chart now to see more details. The context pretty much tells us why this happened to her. And that was because of the excessive period discharge. So what do? What can be done about it? Well, nutrition is the first step, right? So she needs to do something about her diet and restore the things that she lost. She can take herbs as well to do the same thing. Let's see if the chart has any indications that could be helpful. We can see that Neptune is on the second cusp, diet, the things that she eats. So there is an indication that there is something that she's eating that was not feeding her properly. So during her period, she would be wise to increase certain nutrients in her diet to avoid that kind of problem. So Neptune here is giving her that information. There's something about what you're eating that you're not seeing. Okay, Neptune shows hidden things. So the chart is saying, okay, do something about her diet. That's going to work in this type of situation. There's another interesting thing. Is there anything particular about what's missing in her diet? If you look at the table of dignities, you will see that Venus exalts Mars. So Venus values Mars. Mars in Pisces exalts Venus. Okay, so they're in mutual reception, these two planets. So Venus wants Mars, and Mars wants Venus. And Mars is combust. Mars is kind of hidden as well. So what is it that Venus wants that's hidden And that's one question. Let's take a look at what the sun means, because that may give us a clue. Look at the sun. Okay, forget about the querent, okay? The querent is not here. The entire chart represents her body. So this is the anatomy we're looking at. So we're looking at the houses for significators. So the sun is the ruler of house 7 from the first house, or from the 7, that's her house. So if we look at one of those tables, you will see that house 7, it can signify many things. That's why we need the context, right? She had a strong period discharge. The internal reproductive organs are signified by house 7. Here we have the sun, which is her reproductive organs, hiding or obstructing, controlling Mars, and Venus wants Mars. If we look at the context again, Mars is the natural ruler of iron. If you lose a lot of blood, you lose a lot of iron. And that's where we have her condition. She had an anemic condition that's cardinal, that arose that morning. So we link everything. Because of the blood discharge, she lost a lot of iron, and she needs to restore iron in her diet. And that's going to benefit her. Okay, so the iron is going to come back to her because she wants iron, and iron exalts her. Iron is very good for her. This was in the morning that this happened. So instead of eating toast and coffee, you eat beans, lentils, beef, change your breakfast. That's the first thing you have to do in order to improve. And so it proved. By the end of the day, she was fine already, and the problem didn't come back to bug her. So whenever you get that part of the month, make sure to supplement your diet with more iron at least, and maybe other related nutrients. And that's what Hippocrates said, right? He said, let medicine be thy food and food be thy medicine. And this is a perfect example of that. If you eat properly, this problem will not happen, especially because it's a cardinal problem, so it's easy to treat. But it was pretty severe. It's a 4th degree. If she kept eating the things she was eating, she would faint and she might end up in hospital, right? Because it was so severe. But in this case, she treated in a natural way and recovered. There's some more details in the chart. She's Saturn, and Saturn also rules house 12. This is a typical configuration that you'll see in many, many charts. She and her hidden enemy are the same planet. So she is her own enemy. And there's nothing spooky about this. It's simple to interpret this. She was eating the wrong diet, okay? And she was happily doing it because she does that every day. But by doing that, she was harming herself, okay? So she's her own enemy. It wasn't an illness that came from outside. It wasn't COVID. It wasn't a bomb that fell in the neighborhood. It was something that she was doing, a habit that she has that was causing her harm. So that's a house 12 matter. People are scared of house 12. There are cases where you have to be, but here it's simply saying that she was doing something against herself. And if the chart shows it, it's good to pay attention because it will give you clues about where to go in the chart. And we know it's the diet, the problem. We see that Mercury is near the sun. So, and we interpret the sun already. So if there's another planet near an important planet, we know that the other planet is important as well. But how are we going to interpret it? What else can we see here? So what is Mercury? Well, we can look. Mercury rules house 5. Then you look at the list, and house 5 can mean the heart, the liver, the gallbladder, the pancreas, the spleen. And so what are we going to say to the querent? Or it could be any of these things. It's useless, and it just confounds the person. So don't do that. Unless you are sure what it is, don't do that. you can say that, well, there seems to be an issue that's underlying this, and stay at that. So she needs to do more exams, see another doctor, whatever. That's good information to tell her that there's something else going on. But we're going to figure out what it is. I figured out years later. Look at Saturn's antecedent. So it's 16 Libra, 14 Pisces. Very good. But this is enough to tell us that Saturn and Mercury are together. So remember what I just said, that a planet near an important planet is important and we need to pay attention. Well, we have another planet near another important planet, so we need to pay attention to that. So Saturn and Mercury are effectively together, right? So we have another clue that there's something else going on here besides her basic complaint. We can take a look at Mercury. Look at the dignity of Mercury. Is Mercury happy, unhappy, in good shape, in bad shape? Mercury is in Pisces, in its detriment and fall. It's the most unhappy Mercury in the zodiac. As I said, I could not interpret this. We don't have context for it. Years later, we found out that she was diagnosed with diabetes type 1. And diabetes type 1 is an issue with the pancreas. So this chart is saying that her pancreas, which is the ruler of house 5, is conjunct Saturn. So her pancreas is in bad shape and is afflicting her. And it had an influence in this thing that happened to her. I'm not a doctor. I cannot make that connection, but the chart's saying that it's connected. So in general, what I can say is that her overall health condition was a contributor to what happened to her. The diet contributed to the acuteness of the crisis that she experienced. But the fact that she eliminated too much blood has a connection to the fact that she is diabetic type 1. The chart is telling us that a few years before she was formally diagnosed. Saturn is near Mercury by antecedent. It means that this connection cannot be seen, and it's exactly the situation. She didn't know she was diabetic at this time. The fact that her pancreas is in bad shape is hidden from her, and the fact that her Lord 6 is in house 12 also shows that it's hidden from her, because house 12 is the house of things that are hidden from you. And it shows that her illness, there's something that she's doing against herself that's contributing to her condition. And in a diabetic type 1 situation, this is very congruent because this is a late onset diagnosis. You're born with diabetes type 1, right? But if you're diagnosed when you're born, then you receive insulin throughout your life, and that's your treatment. But here, she didn't know. It was a late onset. So whatever she was doing in terms of diet and other things in her life was harming her. And this chart is talking about that as well. Now that we know that there is diabetes type 1 involved, we know that her immune system is part of the picture. And Saturn is the ruler of the immune system. It's not at all bad, but it's retrograde. So it's malfunctioning. And the cause of diabetes type 1 is a malfunction in Saturn, right? Because the immune system is destroying the insulin-producing cells in the pancreas. Beautiful symbolism. Everything that was relevant for her is shown in the chart. Imagine what doctors would be able to do with this type of tool. It's really amazing. Maybe someday medicine and astrology will come together like it was in the 17th century.